Rethinking diabetes diagnosis. Is HbA1c the sole indicator? For years, we've been told that diabetes is defined by one number, HbA1c. If it's 6.5% or above, you are diabetic. But what if I told you that this number doesn't always tell the full story? At DRC by EliteAyurveda, we've seen real cases that challenge this rigid classification. Patients who are symptom-free, with normal fasting and postprandial glucose, yet their HbA1c stays above 7%. Are they still diabetic? The problem with relying on just one number. First, let's talk about how the definition of diabetes has changed over time. Decades ago, a fasting blood sugar of 120 mg per deciliter was considered normal. Now it's been lowered to 99 mg per deciliter. So, was everyone in the past suddenly diabetic? Or did the medical guidelines shift? What if I told you that many patients still thrive with slightly elevated HbA1c, without medications, without symptoms, and with perfect metabolic function? Should they still be classified as diabetic? Real-world cases that challenge the status. Let me share a real case. A 70-year-old patient came to us with an HbA1c of 11%. After 3 months of Ayurvedic treatment and lifestyle changes, he dropped it to 8%. But then, it wouldn't go lower. But here's the catch. His fasting and postprandial sugars were normal. His energy levels were great. No symptoms, no medications. So why should he still be considered diabetic? Cases like this tell us that HbA1c alone cannot define metabolic health. It's just one piece of a much bigger puzzle, a more holistic way to diagnose diabetes. So instead of fixating on a single number, what should we look at? A complete metabolic assessment should include fasting and postprandial blood sugar. Are daily sugar levels under control? Insulin sensitivity markers. Is the body responding to insulin properly? Inflammatory markers. Is chronic inflammation causing insulin resistance? Gut health and digestion. Is nutrient absorption supporting metabolic balance? At DRC by EliteAyurveda, we go beyond numbers. We focus on restoring true metabolic balance, not just chasing HbA1c targets with medication. Ayurveda's approach to true diabetes reversal. So, how do we achieve real diabetes reversal? Instead of just looking at sugar levels, Ayurveda works at the root cause, balancing digestion, reducing inflammation, and restoring insulin function. Insulin sensitivity formula improves cellular response to insulin. Pancreas rejuvenation blend supports beta cell regeneration. Anti-inflammatory blood sugar control reduces chronic inflammation. Gut healing probiotic formula strengthens microbiome health. Detox and metabolism booster eliminates toxins for optimal glucose metabolism. Unlike Western medicines that require lifelong use, our Ayurvedic formulations are adjusted as your body heals, leading to real independence from diabetes medications. Conclusion: time to rethink diabetes diagnosis. So, is HbA1c the sole indicator of diabetes? Absolutely not. You are more than just a number. If your sugar levels are stable, you have no symptoms, and you feel great, why should a single lab result define you as diabetic? It's time to move beyond outdated diagnostic labels and focus on true metabolic health. Want to break free from the HbA1c trap? Visit Diabetes Reversal Clinic and start your journey to true diabetes reversal without medications.